Welcome to Pursuit of Medicine. This is Dr. Memdani, and we are doing the series of MCQ of the day. So let's dive into the MCQ. So, a 12-year-old boy brought to the emergency department with pain and swelling in the right knee. After a soccer game, he has a history of prolonged bleeding after minor injuries and was diagnosed with a bleeding disorder at the age of 3. So he has a bleeding disorder. And on examination, the knee is warm and swollen, and range of motion is limited. Laboratory value shows the prolonged APTT, but normal PT, normal platelet count also. ठीक है. So what is the next appropriate step of management? ठीक है. So let's first understand the question. The question is that this person has swelling in the right knee after a soccer game, and but he has given, the examiner himself has given that there is bleeding disorder. Otherwise, if he would not have told a bleeding disorder, what you should suspect? You should suspect in such cases that there could be trauma or infection or bleeding disorder. So these three should be your differential, either trauma or infection or bleeding disorder. इधर examiner ने खुद ही बोल दिया है कि there is a bleeding disorder, so we'll go with bleeding disorder, and there is a history of minor bleeds. Now, the bleeding disorder can be due to anything. It could be due to dysfunctional platelets, it could be due to clotting factor deficiencies, anything. But here the clue which he has given us is that the PT is normal and the APTT is not normal. So PT is a indicator of the extrinsic pathway of coagulation, and APTT is an indicator of intrinsic pathway of coagulation. So here he is saying that normal PT. So the extrinsic pathway is normal. Intrinsic pathway has some problem. So generally intrinsic pathway is the common disorder. You can guess from the options. Okay, so here we know that the problem is somewhere in the intrinsic pathway of coagulation. There is a problem somewhere over here. So now we'll look at the options. Administer vitamin K. Vitamin K we do not need to give, except we give vitamin K when there is warfarin overdose, or the person is having a severe nutritional deficiencies, like chronic alcoholic people. They have vitamin K deficiencies, and because of vitamin K deficiency they have bleeding problems. But either it's not like that. Is a 12-year-old healthy boy, does not chronic alcoholic, not already on warfarin. So this is not the right option. And second one is fresh frozen plasma. We give fresh frozen plasma when there are a deficiency of multiple clotting factors. ठीक है, not if a single this thing is affected. Now administer recombinant factor 8. Now if you remember your clotting cycle, recombinant factor 8 comes in the intrinsic pathway. So this can be the right answer. And perform arthosynthesis. Arthosynthesis will do, that is, will drain the bleeding joint, the swollen joint, when this swelling is caused by a hematoma. Okay, why trauma? Either there is not a primary problem is not because of trauma. The primary problem is the bleeding disorder. So arthosynthesis not helpful. Initiate low dose aspirin therapy. See, where does aspirin act? Aspirin acts at the level of platelets. There is no platelet problem here, and we do not need to stop the platelet aggregation. What does the aspirin do? Basically, what does aspirin do is, before clotting start, these platelets, suppose this is a platelet, this is a platelet. If this is a platelet, and if this is a platelet, and this is a platelet, this is a platelet, This is a platelet. The platelets, they all stick to each other. They kind of form a platelet plug. So aspirin, what does aspirin do? It does not let the platelet plug to form. So there is no need of aspirin over here, and it is counter indicated actually. So what is the right answer? The right answer is going to be recombinant factor number 8. In which disease you get a deficiency of factor number 8? You get it in hemophilia A, and it is in X-linked recessive disease. So this topic is a very vast topic. I don't think I have done justice with just one MCQ, but it is our goal that we have to do one MCQ per day. So I'll try my best to stay consistent, give you at least one MCQ per day. It will give you at least some motivation to study. So that is my goal, and we'll solve more questions on bleeding disorders, and hopefully clear the concept more with coming MCQs. So like, share, subscribe to my channel. See, this is a new channel. Keep supporting it. We need your support to grow. And I will be tagging the playlist over here of the past episodes where I have done much better explanation of certain topics. You can see the playlist of other MCQ of the day as well. All right, bye bye. Stay focused, study hard.